I'm Dr. Sujit Amjas. I am from the Department of Urology, Government Medical College, Kozhikode, Kerala, India. I present our study on determination of predictors of disturbed sleep and assessment of sleep quality in men with lower urinary tract symptoms. I have no relevant financial disclosures. Undisturbed and refreshing sleep is essential for physical and mental well-being. Disturbed sleep is less restorative and negatively affect the quality of life. There are very few studies that quantitatively evaluated the effects of lower urinary tract symptoms on the sleep quality and daytime dysfunction. This original article assesses the quality of sleep in men with lower urinary tract symptoms and determines the predictors of disturbed sleep in them using inputs from validated sleep questionnaires and bladder diary. The design of our study was observational cross-sectional study. Our study was conducted among men with lower urinary tract symptoms who presented in our urology OPD. Men with urinary tract infections and neurogenic lower urinary tract symptoms were exempted from our study. Lower urinary tract symptom assessment of our patients were done using IPSS score, International Consultation on Incontinence Questionnaire, male LUTS, nocturia bothersome scores, and nocturia frequency from bladder diary. Those patients with IPSS score less than or equal to 7 were classified as mild symptom group. Those with IPSS score 8 to 19 were classified as moderate symptom group, and those with score 20 to 35 were classified as severe symptom group. Patients with ICIQ MLUTS nocturia bothersome score less than or 5 were classified as mild bothersome group, and those with score more than 5 were classified as severe bothersome group. Patients with nocturia frequency from the bladder diary less than or equal to 2 were classified to have mild nocturia, and those patients with nocturia frequency more than 2 were classified as severe nocturia group. Similarly, the sleep assessment of our patients were done using validated sleep scores, like Epworth Sleepiness Score and Insomnia Severity Index. Patients with Insomnia Severity Index more than or equal to 10 were classified to have clinical insomnia, and those with Epworth Sleepiness Score more than or equal to 11 were classified to have increased daytime sleepiness. Patients with the first uninterrupted sleep period, that is, the time from the sleep onset to the first nocturnal awakening, less than or equal to 2 hours were classified to have reduced sleep. And the stop bank questionnaire was used to assess the risk of obstructive sleep apnea in our study patients. Sleep quality was assessed by comparing Epworth Sleepiness Score, Insomnia Severity Index, and first uninterrupted sleep period in different nocturia groups using appropriate statistical tools. The IPSS score, nocturia frequency and bothersome scores, prostate volume and post-void residual volume were used as a variance for determining the predictors of disturbed sleep using univariate logistic regression analysis. The study was completed in 88 patients. Mean age of patients in our study was 62.8 years. Matching was done for the risk of obstructive sleep apnea using Stockbank questionnaire. The mean Epworth Sleepiness Score showed a statistically significant difference among the three IPSS categories. There was also statistically significant difference in the mean first uninterrupted sleep period between nocturia severity group and nocturia bothersome groups. There was also statistically significant difference in the mean insomnia severity index scores between nocturia severity groups and IPSS categories. Patients with nocturia frequency more than equal to 2 had a 3.8 times higher odds of having reduced first uninterrupted sleep period. Patients with moderate IPSS score had a 7.5 times higher odds, and patients with severe IPSS score had a 21.8 times higher odds of having clinically significant insomnia compared to mild IPSS category. Patients with severe bothersome score had a 2.7 times higher odds of having reduced first uninterrupted sleep period. From the univariate logistic regression analysis, we found nocturia severity, nocturia bothersome, and IPSS scores to be the predictors of disturbed sleep in men with lower urinary tract symptoms. The duration of first uninterrupted sleep period is drastically reduced with increase in nocturia severity and nocturia bothersum. The restorative slow-wave sleep occurs mostly in the first one-third of the sleep period, and interruption during this period results in decreased sleep quality and efficiency. Therefore, the duration of first uninterrupted sleep period is useful in measuring the impact of lower urinary tract symptoms on the quality of life, and nocturia severity and bothersome scores provide important clinical clues to assess it. Categorization of patients into mild, moderate, and severe LUTS based on the IPS score gives an insight about the sleep quality of patients with lower urinary tract symptoms. So, from our study, we got the inference that nocturia frequency, nocturia bothersome, and IPS scores can predict the presence of disturbed sleep in patients with lower urinary tract symptoms. From our study, we came to the conclusion that identification and management of disturbed sleep in patients with lower urinary tract symptoms is integral in improving their quality of life. IPS score is a versatile tool and it can be used for the initial assessment of sleep quality in patients with lower urinary tract symptoms. Measures to reduce nocturia, episodes, and bothersome can prolong the first uninterrupted sleep period, which is an important indicator of overall sleep quality in patients with lower urinary tract symptoms. Thank you for your patient listening. We are happy to clear your queries through the comment section below.